Hey everybody, this is Shelby Blankenship here with MMOA, and I am going to be doing our podcast today talking about sleep, especially for the older adult. So a couple things before we get started. I just want to let you all know that we have some MMOA live classes coming up. We've got November 11th and 12th, so this coming weekend in Wappingers Falls, New York. So I apologize if I got that wrong. And then November 18th and 19th, we're going to be in Westmont, Illinois. I will be there as well as Jeff. So I hope to see you guys there if you're not signed up yet. But let's get to our main topic for the day. So we're going to be talking about sleep. This is one of those things that I think we get a lot of complaints about, especially in the older adult. People talking about either they don't sleep enough, or they're up a lot when they try to sleep, or their sleep wake times get disrupted quite a bit. So we're going to kind of talk about like what those things are, some articles that I recommend looking into so you can help people optimize recovery. Because really, when it comes to sleep, that's what we're really trying to think about, because that's one of those areas that really gets underutilized, especially with people with like chronic pain, cerebrovascular disease. If cognition is a problem, those areas we can really make a big impact if we can optimize people's sleep. So one article I wanted to kind of just let you know about, it's called Sleep in the Elderly, and I'll put a link in the comment notes at the end of this podcast. But basically what it talks about is just the different disorders that can pop up with sleep, especially as we age, and what is like common things that we notice as people age. So one of the things that we notice is that 50% of people complain about their sleep, especially as we get into that 60-65 realm, and especially as we kind of keep going down that route. A lot of this is attributed to medical comorbidities and polypharmacy. And then obviously like some psych things going on, especially if like dementia or cognition issues are on board. When it comes to sleep architecture, there are some changes that are normal changes that we need to be aware of. First, there's going to be an increase in sleep latency, so it's going to take a little bit longer to fall asleep. The time awake after sleep onset is going to increase, and then the amount of arousals from sleep. So this can be for a multitude of reasons. Sometimes it's medication related, sometimes it's just getting up and going to the bathroom. Some of these things we can make a direct impact on from just habitual things that people are unaware. So I think about pelvic floor specifically, because that's a realm that I tend to tap into quite a bit. I'm trying to limit a lot of liquids 2 to 3 hours before people go to sleep can be extremely helpful if incontinence or just going to bed and then having to get up and go to the restroom quite a bit is an issue for them. And sometimes it's just timing of meds. If people are having to take something like a Lasix that's really compounding itself at night, that can be a huge issue of them just getting up and going to the bathroom because their medication is really requiring them to do that, so they don't wet the bed at night. So sometimes having conversations like of what specifically is awaking them at night, it might be that simple, or it might be something far more that needs a little bit more study involved. Like, especially I think about my people who have like sleep apnea, and maybe like the breathing can be a big issue for them. So maybe getting them on a CPAP, or at least directing them to like a sleep study might be super helpful. Another thing that we want to look at is some decreases. So we tend to see a big decrease in sleep efficiency. We tend to see a decrease in total sleep time. And then we also see a decrease, it's called slow wave sleep. So there's 4 phases of sleep. The first 3 are non-REM, and then the 4th one is REM sleep. So I think a lot of people are really familiar with like REM cycles and how that kind of dips in and goes. But the slow wave sleep that we really care about with our older adults that tends to decrease is that phase 3 of the non-REM. And that's like your deepest sleep before you get to that REM cycle. And it's super imperative to help with cognition and memory. So those are a couple of things that are common to see, but some attributes that we could affect. So especially when it comes to sleep efficiency and total sleep time, a lot of our older adults are kind of changing up when they go to bed and when they wake, purely on the fact that like they might not have to go to work. They might not have the needs to get up at certain times like they did before. But there's a lot of really good studies showing that the more consistent you are with the time you go to bed and the time you wake up, regardless if it's the weekend or if it's during your normal day-to-day, the more efficient you are with that, it really can be super helpful on having more adequate and more high quality sleep. And then, especially with sleep efficiency, one of the attributes that they talk about in the paper, and I've seen in other resources, is the lack of sunlight that a lot of our older adults get, especially if they're in a situation like a SNF or long-term care or acute care, where getting outside and like directly seeing the sunlight can be super effective. And we want to make sure that we kind of help promote that sunlight. So what I would do, like in acute care, is like when I would come in the morning and they are awake, we'd try to keep like the blinds open, keep the lights on during the daytime. And then at that like 6, 7 p.m. mark, depending on what the daylight's looking like, is when we kind of start to settle down and have like a little bit less light in the room. And that can kind of just help keep that REM cycle more regulated and just kind of make your body more aware of your normal like awake and sleep times, because it is really easy to get disrupted, especially if you're not able to go outside super often. Another article that I wanted to kind of bring up is there is a study. It was in the Physical Therapy Journal in 2017. It's called Sleep Health Promotion, Practical Information for Physical Therapists. And it has a lot of really nice information and some like questionnaires that you can do with some of your people. And one that I really liked is it had a whole list for sleep hygiene. Sleep hygiene is one of those areas that can be super missed. I think especially nowadays with the capacities of technology, and then TVs not always having to be in like the living room, for example. It can be really easily altered where there's really no obvious time that your body knows, like, this is the only place I sleep. A lot of people, can sleep on the couch and in the living room and not just their bedroom. And it's really helpful to create that habit of knowing, like, hey, when I go to a certain room, when I have a certain routine that starts to like kind of downregulate that nervous system, kind of like prepares yourself for sleep. I tell people this all the time, like, especially in the morning, like most people need like a ramp up time. Like they don't want to immediately go from waking up to like running a 5K or going to work out or immediately getting bombarded with emails and stuff that they need to do for work. And so it's the same thing when we go to sleep. Like we want to have that gradual decrease in the needs of what we have to do. So kind of having that really slow down, regulating that nervous system and keeping things a lot more calm can help that body slowly start to kind of like shut down and be ready to go to sleep. So a couple of things that it recommended is, one, the consistent wake and sleep times, like we've talked about before, a routine that's really relaxing, starting that maybe like an hour before bed. Sometimes that's taking a hot bath or a shower. Usually it does not revolve around screen time, which I think is one that we could use for all generations. It recommends no screens, at least 30 minutes. I would recommend even like an hour to 2 hours. I think it's one of those things that it's easy to get stuck in a loop, especially if you're a scroller and like your reels and those kinds of things, or watching the news. It's one of those areas that if you get stuck there, it's really hard to kind of like calm your system down, especially if like lots of crazy things are happening in the world, or there's, all kinds of things. So that's one area to kind of be super mindful of. Using the bed only for sleep and sex. I think that's one of those, like, people watch TV, they do all kinds of things in their bedroom. Like home, I remember doing homework and all kinds of stuff, but I would say like trying to keep it really designated so that your body, again, without you telling it, knows like, hey, this is time to go to sleep. Decreasing moderate to vigorous exercise 2 to 3 hours before bed. That doesn't usually tend to be an issue with this population, but that's something to kind of keep in mind. Limiting caffeine 4 hours before bed. Definitely no espressos like right before bed. I know that sometimes can be an issue with some of our older adults. They tend to like to have coffee literally all day. Limiting alcohol and smoking. Alcohol, unfortunately, is really going to mess up your sleep. And there's, whether they use like an Aura ring or Whoop, or regardless of how old you are, that's one of those areas that, some people use it as like a nightcap to be able to go to sleep, but really it does tend to affect your sleep quite a bit more than I think people initially realize. So either one, I wouldn't like take it away from them, but just maybe like limiting the quantity or limiting the time period. So maybe trying, an hour to 2 hours before bed. That can also help with pelvic floor stuff. So you kind of get that 2-for-1. Limiting napping to about 30 minutes per day. In that study we talked about with the sleep in the elderly, it has a lot of nice information about the reasoning for a lot of people napping. Sometimes people, where it doesn't matter what time they go to bed, they still wake up at 3:30 in the morning or 4 o'clock in the morning. There's some studies like talking more specifically about that, but the more you can limit those naps during the day, it will help again with that sleep quality during your nighttime. And then the last one, which we kind of talked about earlier, but like getting sunlight within 1 hour of waking can be super, super vital and helpful. This one is like an anecdote, but I've also seen on some studies, not in these two specifically, but trying to wait about 2 hours until you have your caffeine in the morning can also be super helpful from a sleep regulation and just an overall recovery standpoint. So that's another area to kind of look at if caffeine is something that's super important to your client, and trying to make sure that they keep their system regulated appropriately without having to have like just caffeine constantly throughout the day. So just to kind of summarize everything we talked about. So when it comes to sleep, this is a huge attribute into recovery, especially for chronic pain or any type of neurological cognition, any type of ailments that we have, especially in the older adult. This is a really great tool to improve overall recovery. And honestly, this is one of those areas that I think a lot of people don't really they think, what, you can sleep when you're dead kind of situation. And really, this is one of those areas that if we can improve and show how vital that recovery is when it comes to sleep, we're not only going to impact their quality of returning to whatever things they're trying to return to or increase their total capacity, but we're also going to help like from a cognition standpoint, which is super awesome as well. So the two articles that we kind of rehashed was sleep in the elderly, and then that sleep health promotion for practical information for physical therapists. I'll put the link below. So if you want to dive in deeper and kind of there's a nice little printout all about sleep hygiene. And then you can kind of just go through the checklist with your client to see if they're doing those things, not doing those things, and where you can really promote good guidelines towards their sleep, and hopefully kind of get them on the way to, really getting a nice recovery, especially when you can combine this with really good nutrition and exercise. And then of course, mindfulness, like you're going to see a lot of really good results, and hopefully really stave off, if you will, a lot of things that could be popping up from a medical comorbidity standpoint. So that's all for me today. Hope y'all are having a great week, and we'll see you next time. Is that okay? Yee.
You can make it that close. You can do that, darling. You doesn't have to get up.
Ah, yeah, heavy.